In today's video, I'm going to be discussing what tennis elbow is, how we treat it in my office, and what you can do to prevent it from developing in the future. Another common condition we treat in the office is tennis elbow. And what tennis elbow is it's where the muscles that extend your wrist back, where they attach right above the elbow here. And that tendon will get either irritated or it can actually get like almost frayed and it doesn't heal properly. And what happens is that causes pain right at the attachment point where it attaches on the bone there. So often the problem is a repetitive stress injury such as grabbing a racket. That's why it's often caused with tennis. But it could also be just any kind of gripping exercise or anything, just repetitive stress that you're doing on a computer, on a mouse. That can cause tension to develop in the muscle leading up to the attachment point in the elbow. So a lot of times the treatment is we'll treat the tight muscle in the forearm, and that'll help take tension off the elbow here. The laser therapy, that can be used to help heal the tendon where it attaches to the bone. That helps speed up the healing, decrease any pain and inflammation. We can also do dry needling on the forearm muscles here to loosen up tension in the muscles here to take the pressure off there. And then Graston technique and active release techniques are the two other techniques we'll apply to help fix the tight muscle through the forearm, and that'll take pressure off of the elbow. So let's do this. Let's demonstrate what dry needling will look like in the forearm here. Again, what the patient is going to feel with this treatment technique is just a little tap, and then we're going to apply the needle right into the tight area. And the patient may feel a little dull, achy sensation in the problem area. A normal muscle, you wouldn't feel anything. You would just feel just me tapping the needle in there. So this is a really good treatment technique to help release the tension on the elbow. So this is one effective treatment technique for treating tennis elbow. Another effective treatment in treating tennis elbow is Graston technique. With the Graston tool, we're going to take it over the affected area, and it's going to help to smooth out any knots or tightness that have formed in the forearm muscles here. And the patient can actually feel little ridges or bumps where there's a problem. And so she has a little bit of a tension right here in the forearm. Again, this is very common. We don't realize how often we use our hands and forearms throughout the day, gripping things, doing various activities on a daily basis. But what happens is it gets to a point where it tightens up, and then it'll cause pain right in the elbow there. So again, this technique is going to help massage and loosen up any of the tension right through this area here. And when we do the treatment with the Graston technique over a few visits, we'll start to feel they get smoother and smoother as the problem area gets better. The other technique we're going to utilize is an active release technique. So we're going to actively put the muscle through a range of motion. And underneath my thumb, we're helping to loosen up any tension, break up any knots or tension that is formed in the forearm muscles here. Often this technique and the Graston technique, patients describe as kind of like hurts good, feels like we're releasing a lot of the tension here in the muscles. Often this problem can get so bad that the patients can't grip anything. Any kind of light grip, even a coffee mug, will cause severe pain right in the elbow there. That's definitely a situation you need to get treated right away so this doesn't keep developing into more of a chronic issue there. For the more severe tennis elbow cases, we'll use laser therapy to help calm down the irritated area. It'll also help accelerate the healing process in that tendon where there's a problem. So in this case, we're going to apply the laser therapy over the affected region. And the patient's just going to feel a light, mild, warm sensation where there's a problem. And we're going to apply it to the whole area, all the way down from the elbow, all the way down to the wrist. And again, this is just really powerful because it can get about 2 inches into the affected area and help decrease any pain and inflammation and accelerate the healing process. We use this mainly in cases where it's a moderate to severe acute kind of scenario where the patient has pain gripping any activities or doing any kind of daily activities that causes them a sharp pain in the elbow. Laser therapy, though, is a very effective treatment when we're dealing with an acute tennis elbow case. A typical treatment protocol will be about 4 to 8 visits for an acute case. For a chronic case, it could be up to 12 visits or even more depending on how bad the case is. If we don't see improvement within about 4 to 6 visits, that's typically when I will refer patients for an MRI of the elbow to rule out that there is not a more significant tear in the tissue. But usually within 4 visits, patients feel about a 50% improvement, and then it just builds on top of that as we get them better. In addition to treatment in the office, patients can accelerate the healing process by doing certain exercises to treat tennis elbow. And one exercise we're going to have the patient do is we're going to have them do, we call an isometric exercise. And what that means is we're going to have the patient hold her wrist back in this position, and then she's going to use her other wrist, but I'm going to demonstrate it in the office here. I'll use my hand as her force here. So what I'm going to have her do is I want you to resist me pushing your wrist down. We want about a 10% contraction up against my wrist, and we're going to have the patient hold it for about 30 seconds. So again, this is called an isometric exercise, and it's very helpful for treating tennis elbow. So we want the patient to hold and then relax. And then we're going to have her extend the wrist back, hold, resist me, 10% of your power, just push into my hand. Hold, hold, and then relax. And again, she's going to repeat that throughout the day, preferably about 5 to 7 times throughout the day, just giving a little bit of a contraction to that muscle. And what that does is it helps stimulate the tendon so it can heal, and it can take the pressure off the attachment point there. The other exercise that we'll have the patient do is then what we'll do is once we've progressed them in this position, then we'll have them hold it down where their wrist is straight. Again, I want you to resist me pushing your wrist down. And this is going to be a little bit more stressful for the tendon. And so this is more at an advanced level. And we're going to have her resist and then relax. And then hold. And again, we want her to hold there for about 20 to 30 seconds. And relax. That's one of the main exercises we'll have the patients do to help rehab a tennis elbow case. One additional treatment that patients can do at home that will help accelerate the healing of the tennis elbow is we'll use kinesio tape, or in this case we're using a brand called Rock Tape, and we'll apply it to the injured area. And what that does, it just takes pressure off the injured tendon, and it will accelerate the healing process in that tendon. So what we're going to do is we're going to have the patient fully extend and then flex. That's going to make the muscle fully stretched out. We're going to apply the tape right above the injured area, and then we're going to follow it down most of the forearm there. And again, this is just going to take a lot of the pressure off of the injured area and allow them to function throughout the day without irritating it. You may have seen people wear these braces right in this region too, and that's another option, is you can put a strap above, kind of right at the top of the forearm here. And what that does is it does a similar thing. It will take some of the pressure off the injured area. But this is nice because you barely know it's there. It's just another kind of part of the skin there, and it just basically is going to take pressure off the injured area. Whereas the strap's a little bit more compressive and a little bit more uncomfortable to wear. A lot of times you'll see tennis players wear that if they're dealing with an injury. But it basically is, it's acting like a crutch. It's not actually fixing the problem. We're going to use this only when the patient is dealing with an active problem. Once we get them better, they don't need to wear this as a long-term treatment. So if you're dealing with tennis elbow, I would highly recommend using Rock Tape to help accelerate the healing process. So if you're dealing with tennis elbow, give our office a call at 703-912-7822, or you can visit us online at novachirowellness.com.